Welcome to the DNX podcast, the #1 resource for entrepreneurs, nomads, and impact-driven souls. And I am your coach, Sylvia Christman. I'm here today with Dr. Amy Killen, who is a regenerative medicine physician who specializes on sexual health. How are you, Amy?
I'm great, thank you.
I'm so excited we get to do this today. We met a couple of weeks ago at a conference, and you were giving a presentation around sexual health and stem cell research. And I thought it was so fascinating to listen to you and your joy and the joy that you brought into the room, and how freely you really spoke about how important it is for us to talk about sexual health and treat sexual dysfunction. So I'm curious, how did you actually get into this?
It's kind of a long story, but I initially was an ER doctor. So I did emergency medicine for about 10 years. And towards the end of that, I noticed several things. First of all, I felt a lot of frustration in that I felt like my patients were just not getting better. They were chronically ill and they'd come back over and over again for the same things. And so I started becoming interested in preventative medicine and how, what can we do to prevent these people from being so sick their whole lives? So that was part of it. And then the other part of it, the more personal part, was that during this time, I had 3 kids in 2 years. And when my son was 2 weeks old, my husband got a job working out of state. And so he essentially moved out. So it was just me and my 3 kids. And I was working in the ER at a shift that started at 4 a.m. And I just became very unhealthy. I'm just eating garbage. I was drinking a ton of soda and Monster energy drinks. And
Wow. Yeah.
all of it. I would drink. It was like 100 ounces of Diet Coke and two Monsters just like during a 10-hour shift. And then obviously I couldn't sleep at night because obviously I was drinking a lot. And so I would sleep like 2 or 3 hours and then I'd be tired and I'd do it again. And I was just super stressed out. Meanwhile, my husband's gone. And so that was bad. And then there was an episode that kind of is stuck in my brain as being important. I don't even know why, but my husband was home and my daughters had lice at the time. So we had gone through the lice protocol to try to get rid of the lice. And we finally did. And the lice lady who came to help us told us that we needed to do these lice checks on each other. So there was this day where I was sitting with my husband and I was sitting in between his legs on the playroom steps and he was looking for lice eggs in my hair. And all of a sudden, it kind of struck me that, like out of nowhere, that this was the most intimate that we had been with each other in months. This sort of just simple act of, looking for lice eggs in my hair was the most that we had touched in a long time. And this was sort of devastating to me at the time because I realized that not only was I kind of falling apart from a health standpoint, just in general, that our relationship was also falling apart and I needed to sort of take steps to figure out how to get that back. So I became interested in preventative medicine and sexual medicine at about the same time, which is perfect because the two of those things really go together perfectly, which is what I am very, very much interested in now.
That's so fascinating. So where do you see is the link between preventative medicine and sexual health?
Sexual health is very much an indicator, especially in men, but it also can be in women. It's a very indicator of potential other diseases and illnesses going on in the body. So for men, for instance, we know that erectile dysfunction is a precursor of and also an indicator of other blood flow issues. For instance, things like coronary artery disease, like heart disease and strokes and things like that can happen in the years following developing erectile dysfunction because it's the same mechanism, the same type of inflammation that causes ED will later on cause a heart attack and later on cause a stroke. The same kind of inflammation that causes ED is also associated with other things like, with diabetes or with high cholesterol. So there's very much a link between what's going on in the penis and what's going on in the rest of the body.
Interesting. So do you think, is there a relationship between the hardness of the erection and the lifestyle choices that may have led to heightened levels of stress and therefore decrease the sexual health?
Yeah, absolutely. No, certainly not everyone who has erectile dysfunction, has it because of poor lifestyle choices. It can just happen sometimes, but we don't even always know why. But there's very much a relationship. We know that, people who have high blood pressure chronically, high cholesterol, smokers, people who eat high sugar diets or high carbohydrate diets and have a lot of inflammation and plaque in their arteries, all of the sedentary lifestyle, all of these things can definitely lead to, or at least predispose people to developing ED later on.
Interesting. What about eating a lot of meat? Like the very masculine diet of meat, potato, and lots of animal products. Does that have any relation to
Um,
that?
I haven't seen as much research about meat. I mean, certainly we know that you do need some protein in order to make testosterone properly, and testosterone is important for maintaining erections. So, I do see some patients who are vegan who don't get enough good protein, who will have problems with low testosterone, partially from that. But I haven't seen, certainly people who are eating super high levels of meat and potatoes kind of thing are going to have more inflammation than people who are eating a more plant-based diet with just, with occasional good protein bases mixed in.
Right. So are people aware that they're actually having problems, that there is a form of sexual dysfunction in their life?
That's a good question. I mean, certainly men are usually aware because it's this thing they can see, and they can sort of, it's part of their, I was going to say hold on to, but that just sounds wrong, but they can see it. And their partner can see it. Everyone knows it's happening, whether or not it's talked about. I've certainly had male patients come in and I've had to kind of probe them, with these very probing questions about their erections in order to get them to admit any problems. And once they do, even then, they oftentimes haven't spoken to their partner about it. They'll be like, yes, I'm having these problems with erections that are not lasting as long, or they're softer than I want them to be, or they're not as sensitive or whatever. But maybe they've never actually talked about this with their partner, which ends up being a problem because then the partner, starts to feel very much like it's his or her fault. I'm not pretty enough. I'm not cute enough. I'm not sexy enough, and all of a sudden you get this really sort of negative feedback loop happening, in the relationship. And then the same thing happens with women. With women, I often see women who will come in who are having sexual problems that bother them and have bothered them for years. And oftentimes they've never talked to their partner about their problems. They've just been kind of suffering in silence for years, sometimes for decades.
Why? Why do you think that is?
I think for women, part of it may be cultural thing. Maybe they haven't been brought up to feel like their sexual experiences are important. Maybe they were brought up to think that their job is to have babies and be a good mom or whatever. Or they haven't been brought up to speak out about those kinds of things, like talking about, oh my gosh, my orgasms are not what they used to be, is not something that they're just comfortable doing. I think some women also just don't feel like it's that important. I have a lot of patients who I'll ask about their sexual health and they'll say, I don't have a good sex drive, or I'm not having, sex is not really that fun or whatever, but it doesn't bother them. And actually for those patients, we don't talk about them as having dysfunction. If that doesn't bother them, then, there's nothing I can do about it. But it's the ones who it does bother them, but they're still not speaking out. Those are the cases that really get to me, because I feel like, we need to empower those women to step forward and be like, hey, like I deserve this. This is an important part of my life.
Yeah. Do you think there's a real need for people, for us to place more of an emphasis on female sexual desire?
I do. And desire is certainly part of it. With females, we talk about the desire. We talk about we talk about arousal. We talk about orgasm. We talk about, lack of pain as being the things that we're looking for in sort of a good sexual experience. And I feel like there's certainly there are people researching this, and there are people trying to make medications that can help women, just like we have Viagra and such for men. But there just isn't as much work being done for women as there is for men. And part of the problem, I think, for women is that for women, it's much more complicated than just, can we get blood flow to this organ, to the vagina, to the clitoris. With men, if we can get blood flow into the penis and keep it there, we're done. Good job. Like that's what we want to do. For women, we can get blood flow there, but it doesn't mean that they're having a good sexual experience, because so much of their experience is about how ready they are sort of from the brain standpoint to have this experience. So it's much more complicated than women, which I think makes it much harder to study in women and to find these good answers for women.
Interesting. So how does stem cell treatments, how do they help?
So we can use stem cells. Stem cells are one of my main areas of interest, and I love them. Stem cells are your body's repairmen. So you have stem cells all over your body, and their job is to regenerate different tissues. So like if you get hurt and you get injured, your stem cells are there to make new collagen, make new blood vessels, make new nerves, things like that. So we can actually use stem cells in the sexual organs. So we can take stem cells either from the patient, like from their fat or from their bone marrow, or we can get stem cells from other sources like umbilical stem cells or exosomes, which are kind of parts of stem cells, platelet-rich plasma, which we use commonly. And we can inject those things directly into the sexual organ, so into the vagina and clitoris or into the penis, to actually bring about some regenerative changes that result in things like increased blood flow, increased nerve regeneration, sensation, improved orgasms, improved sensitivity. All of these things can help those organs sort of be more youthful.
Fascinating. Does that hurt?
That's always the question, right? People always ask that. So, and that's appropriate. People, so we use a topical numbing cream before we do the injections, and the injections are, it's a tiny little needle. They're not big. But so it hurts it doesn't hurt very much. It's basically like a little kind of small little pinch, and then it's over. It doesn't hurt anything. Afterwards, there's no pain. There's no downtime afterwards. You can resume all activities immediately afterwards. So it's a pretty easy, 10-minute kind of procedure to get these things done, and it can vastly improve people's sexual experiences.
That is so fascinating. So how many of those treatments do you need?
So it depends on the person. Some people will just have one and they're done. Some people will have some improvements after one, and they'll come back, 3 months, 6 months later and say, let's do this again so I can have more of an improvement. So it depends on the treatment they're getting. For instance, are they just getting platelet-rich plasma, which is made from the patient's own blood, or are they getting, sort of a higher level treatment, which includes like stem cells or exosomes? So all of that, affects how effective it is, but it can be just a one-time thing.
So I'm curious, do you actually have to have a problem to get stem cell treatments, or can you just do it for fun because you're thinking, maybe I'm thinking this, like, can I just do it again, more and better and bigger orgasm? It sounds like a really great idea.
It sounds fantastic. No, you can absolutely do it for fun. In fact, probably like half of my patients just do it for fun. And I have people who have really good experiences just from they didn't feel like they had a lot of problems going in. Like I treated, and she talked about it openly, so I can talk about it too. But I treated Dave Asprey's wife several years ago, and she was like, I'm fine. I don't have any dysfunction. Like, I just want to kind of see what happens. And a few months later, she got up on stage at a big conference and did this kind of testimonial about her experience. And she was, she talked about having these toe curling orgasms for the first time since she was like 20 years old. And she was like, I didn't know I had a problem. I didn't think I had a problem, but now I realized it could have been better, and now it is. And so that's kind of something that we see with people as well.
Yeah, sign me up.
Right?
I'm into it. Yeah. What do you think are still the biggest obstacles when we're looking at sexual health and treatments that are available, other than like getting people excited about it? I mean, if we could get people more excited about the prospects of it being even more exciting, fulfilling, and expansive in an experience, what are the obstacles here? Do you feel that people feel alienated and alone?
Yeah. I feel like people are still not willing to talk about this, even though, we see Viagra commercials and we see, there's porn everywhere. Like, we see all of these sort of symbols of sex on a daily basis, but we don't actually talk about some of the more real types of sexual dysfunction and what they can do to relationships. We also don't talk about how important sexual health is for a longevity standpoint. We know that men and women who have regular sex actually have lower mortality rates going forward, that they have about a 50%, at least men, 50% lower rate of death over 10 years or so if you're sexually active versus not. You have better immune system, you sleep better, you have less stress, you have lower blood pressure. There's all of these things that tie sexual longevity to actual longevity. So I think it's important to think about sexual health as one of the things that can help us not just live better, but live longer. And if we can think of it like that, then maybe we can start talking about it more as just being a really big component of our health, and not sort of this taboo subject that is only in Penthouse magazine.
Fascinating. Yeah, I find this so fascinating because I agree. I mean, when you have regular sexual encounters and you're sexually active, your experience of life completely changes. And that's so interesting to hear that there's an actual scientific link to longevity. So you said it's for men, it's 50%. What is it like for women? Is there a difference?
So I haven't seen. There are studies that have shown women who have regular sex have longer longevity. There's some evidence that women who have regular sex, and by regular, it's usually once or twice a week, is what the studies are looking at. Women have longer telomeres, which is one of the long telomeres are directly tied to longevity. People who have longer telomeres, which is one of the sort of the ends of the chromosome, they live longer. So we know that that's the case. I don't know the exact numbers as far as the rate for women, but it seems to be the same as far as both men and women seem to live longer if they're sexually active.
So do you think women are understudied here? That's what it sounds like.
What about the women?
Here?
Let's talk about the women. Yeah. I mean, in general, I think women are understudied in this field, and that's one of my sort of main passions. Is let's talk more about the women, because I feel like we make up half the population. Why are we not making up half of the studies in in all of this?
Yeah, 100%. I'm fascinated by sexual desire and the lack of conversation around love, sex, intimacy, and potential problems, and the hesitation of people to really talk about it. Because once you allow people to talk about it, they actually get quite chatty about it. Don't you think?
Oh, absolutely. Yeah. It's fascinating having patients come in and, like I said before, I do a lot of work with hormones. And so I'm asking questions that are kind of around, a lot of sort of pseudo sexual questions. But it's not until I really probe that I get them to really open up. And then when they do, we'll have like a 30-minute conversation, just about what's happening in the bedroom. But until then, they haven't spoken about it, in 10 years. And so it's, right. And even with, even with people, even with like best friends and such, it's just very interesting, sort of almost taboo topic that people don't bring up that much. I mean, they'll talk about like how, I feel like with men, especially, they'll make comments and, about sex all the time, but they don't talk about it in a real way. Like that I'm having, erectile problems, or things don't feel like they used to, or, et cetera. So yeah, let's talk about it in a real way. And then we can do things, because we actually have some technology now, not just stem cells, but things like vaginal lasers, nitric oxide boosters, shockwave therapy for ED is really effective, hormone replacement and optimization. Like, we have the tools to actually improve people's experiences significantly on a regenerative level. So you're not just putting a Band-Aid on it, you're actually changing the way the body is functioning. And if we have the tools, let's use them, but we have to know there's a problem first.
So when you look at hormonal levels in the body, does lifestyle changes affect the hormones, which then affects the sexual health? Or can your hormonal levels also be improved if you have regular sexual intercourse or activities?
Yes, lifestyle definitely changes hormones. Certainly, age. We know that as we get older, for women, estrogen, testosterone, progesterone all decrease. For men, testosterone decreases. And as this happens, this affects not just our interest in sex, but also sort of the structural health of the sexual organs. These hormones help to maintain the structural health of both the vagina and the penis. So, age is a big part of it. And then, certainly, the things you put in your body, the toxins in the environment. It's actually interesting. Men's testosterone levels are much less than they were 50 years ago. So just on average in the world, testosterone has gone down quite a bit. And it's probably due to lifestyle choices as well as environmental toxins. We know that there are quite a few of these endocrine disruptors, which, affect testosterone levels out in the environment. And so, you combine that with a pretty poor diet, which causes a lot of inflammation. And all of a sudden you've got low testosterone, which is now, it's kind of this big problem that we can treat, but it is something that we didn't have to worry about 50 years ago.
Interesting. Very interesting. So if somebody wanted to improve their sexual health, for a woman, the top 3 things that they could do to go on a journey here and see what they can expand in their experiences?
That's a good question. I think with women, again, it's very difficult because their sexual health is very much tied to their relationship health and their, it's emotional health. And it's not just sexual organ health. But if you're talking about sexual organs themselves, so vagina and clitoris, blood flow to those areas, that kind of thing, then the main things I would say, strengthening the pelvic floor is important. So you can do this at home. Certainly we know about like Kegels and doing exercises like that, but there are also some pretty cool devices out there that use things like TENS units, TENS units for your muscles where you can kind of stimulate them with the little electrodes. They have devices that are intravaginal. You can actually put in the vagina, like the intensity device is one of the ones I give patients, that they can do these like little exercises, at home that stimulate their pelvic floor muscles to be able to be stronger, to contract more. So you have stronger orgasms. You also have a, less urinary leaking and things like that. So that's a great at-home thing you can do.
So what do you think about the jade egg?
I don't have any personal experience with the jade egg. I will say that. Okay. I do think that things like that, maybe not the egg itself, but there are some other sort of cool, gamified intravaginal devices that can measure, measure the strength of your Kegels, measure the strength of your pelvic contractions, keep track. They'll like send you messages like, you need to do more contractions, like it's kind of like a video game. Meet China, and I think that's kind of cool. Like, let's make it more fun, right?
Yeah, interactive,
So I'm on board with those kind of things.
I have the jade egg, but it's a very sort of like self-driven motivational thing, But if you gamify it, there's much more motivation involved in the process. I can see.
Yeah, that. Exactly. You're like tracking yourself. You're like, well, today I got 50 points, and yesterday I only got 40 points, so I'm totally winning at this. Like, it gives you like something to look forward to.
Instant gratification makes all the difference in the world. That's awesome. Yeah,
it's good. Yeah. The other thing that I think is a really good thing you can do for men and women is making sure that you increase your nitric oxide levels. Nitric oxide is important. It's for opening up the blood vessels and letting the blood flow to your sexual organs. And a lot of us, as we get older, after age 40 or so, those levels go way down. So things like eating, green leafy vegetables and beets and pomegranate and dark chocolate, which is not hard to eat, could be helpful. Exercising obviously is helpful. And then certain supplements, things like L-citrulline and L-arginine and antioxidants can boost nitrates and be helpful. And those are good things at home. And then, the main thing is lifestyle is important. And making sure you're not smoking and doing all the things we talked about earlier, just to keep the inflammation down so that you've got good blood flow. Those are the things that you can do preventatively. And then there's a whole toolbox of things, that we can do from a medical standpoint at this point that can make a big difference as well.
Interesting. So, from a life, I always call it the rapid aging plan: lots of drinking, lots of smoking, and an inflammatory diet. Are those the three main killers of sexual health?
Yeah, definitely. And in fact, I used to always joke with, and I still do, I joke with my patients that, I don't have too many patients that smoke anymore, but that my plan was that I was going to just take these boxes of cigarettes and I'm going to put a picture of like a limp penis on the front of the cigarette. And I'm going to sell the cigarettes like that, because I feel like if men knew that smoking is one of the biggest ways to get erectile dysfunction, that they would be like, whoa, wait a second. Yeah, my heart's not working. That's fine. My brain's not going to work, lung cancer, whatever. But talk about, I can't have an erection. Like all of a sudden it's real.
That will drive their motivation. I buy it for sure. Thank you so much. This was so enriching. I hope the people who are listening enjoyed it. We'll definitely put the links of the resources below this podcast as well. And thank you, Amy. Thank you so much for sharing all of your wisdom.
Thank you. Have a great day.
Thank you so much for tuning in and listening. I hope you enjoyed it. Before I leave you, I want to invite you into my world. Join us at the DNX Festival in September in Lisbon. If you go to our website and use the promo code podcast50, you get an extra €50 off your ticket. And subscribe to this channel and leave us a review if you can. We will review these frequently, and you can leave us a question that we will answer live online. Until next time.